five. Virtual high five. Good job, guys. Woo. Absolutely. Vital signs are important. They indicate wellness or the overall well-being or not of the patient. All right, so the patient has an irregular pulse and you're getting vital signs. So radial pulse 15 seconds multiplied by 4, radial pulse 30 seconds multiplied by 2, radial pulse for 1 full minute, or carotid pulse for 30 seconds. Oh, there we go. Yes, it's the radial pulse 1 full minute. If they have an irregular rhythm, you want to make sure you're doing the pulse for 1 full minute to make sure you get an accurate reading. Respiration 17, blood pressure 118/80, heart rate 160, and temp is 99.0. Yep, it's the heart rate. Weight, keep in mind that's not really a vital sign. And the blood pressure was normal, 118/80. So anything less than 120 and less than or equal to 120 or less than or equal to 80. Ooh, Veronica, climbing up. Which vital sign in a healthy adult is abnormal? Blood pressure 120/80, respirations of 14, pulse of 60, or a temp 38 degrees Celsius. All right, it's actually the temperature, guys. So keep in mind, normal respirations for an adult are 12 to 20. So 14 is fine. Normal pulse range is 60 to 100. Y'all knew the blood pressure was fine. So it was the temperature, 38 degrees Celsius actually is technically normal, but it's on the higher end normal. Everything else was close. That was kind of a tricky one, I'm sorry. If you get an abnormal vital sign, it's very important that you do what first? Record it, call the doctor, look at the patient, or retake the vital sign because they are probably wrong. Oh. Good. Look at the patient. So this is what kind of like an NCLEX question because it says it's very important that you do what first. What is the first thing are you gonna do? So you're gonna have normal vital signs and you go, oh, I need to record it, or you're going to, look at your patient. Do they look like it's bad? Do they look like it's good? So you want to look at your patient. Probably then you're gonna retake it just to verify. And then you'll record the findings. Yay! You got it. Yes, hypothalamus. Yes, Christina, you should be looking at them while you're doing it. But first thing first, you should do, take vital signs, look at your patient. If you're not the one taking the vital signs, and your tech comes to you and says there's something abnormal, what are you going to do first? You're probably going to go look at your patient, right? So the hardest part for you guys is going to be thinking like a nurse and not a tech. So you may be delegating the vital signs. Usually they do. Yep, 60 to 100 is the normal range for pulse. If you were talking systolic blood pressure, 80 to 120 would probably be. Yes, Adriana, I will post it. Couple more, guys. Oh, that's okay, Alicia. I can post this so you can do it yourself at home. Yep, 12 to 20 is the normal blood pressure or normal respiratory range. Sorry. Do you like the picture going along with the blood pressure question? Ooh, guys. So remember that symbol is greater than 120 over greater than 80. That's considered high blood pressure. So a systolic of 100 to 120, some say 90, and then a diastolic of 60 to 80 is actually the normal range. Yeah, fat fingers is a common problem, Sean. True. Yes, you guys remembered. So remember, 4 phases for children, you're going to listen, 5 phases in adults. Last one, guys. I tricked you on that one. So I tricked you on that one in that you should double check them. So if you get abnormal readings, check them again. Okay. Well, that's totally different. That doesn't have, this question is asking if the patients are abnormal, you should, I know, I told you I was a Slytherin. But Nathan, the provider didn't ask. This says nothing about a provider, just says you went in there to, you got vital signs and there's an abnormal. It doesn't have to do with the physician. So you could be doing your regular shift vital signs and there's an abnormal. So yeah, you need to check them again. That would be the answer. Aha. Assuming. Yep. Yes, Kevin, absolutely. And you might even document your patient had initially abnormal and you recheck the blood pressure was still XYZ. Absolutely. So, awesome job, guys. Yay. So technically no. You got abnormal vital signs, you need to recheck them. All right, let me. All right, guys, good job. Oh, you're welcome, Veronica. Thank you guys for staying. I know some of these will run a little over and some of them will run a little under. It's all going to also change. Doing this online versus in the classroom changes it over. So I appreciate your patience and everything with that. I'm actually working on more Kahoots. After each chapter. Yeah, see this one, Natalie, it's the answer to the last one was false. Because you don't, yes, you're gonna record them, but first thing you should do is recheck it. So that's where this and I kind of threw that out there because a lot of the questions will be what's the first thing you do? And a lot of you will go, well, I need to record them. No, the first thing you do is recheck it. So it was a tricksy one, I know, but that's how the NCLEX is. So yeah, I really want to try to I'm going to work on making Kahoots for each chapter so that we get see, Courtney, that's a big thing. Like I said, you guys are going to be it's a different world of thinking, so some of what you know you got to throw it out the window. Some of the questions I actually took from the chapter review questions at the end of the chapters. But mostly, actually, Kahoot has a really good. I can steal a lot of them were stolen from other people who created Kahoots on the same thing. So, so I will post those. This last one especially because I know there are a few of you who had to leave. I'm recording this, that's why I'm saying it, guys. So, does anyone have any questions? I know I also need to post. Yes, Quiz Tuesday and Kaplan is due. Well, thank you, Veronica, and everybody who made recommendations Tuesday. It inspired me to try and work on it. I know you guys like the quick quiz questions, so I thought instead of just doing quick quiz, we can get through each chapter during a lecture and then go review it and then go on. No, Courtney, you don't need to submit anything. Just do the Kaplan, and I actually can log in. And on the faculty side, I can see who's done what. So you guys just to go do the Kaplan, and I will the focused review exams, Jessica. It is due by the start of class. So you should have received captest.com, and then you log in and you want to look at your focused assessments. Yes, there is a quiz on Monday for farm. I know, I apologize, you guys. I will let you know, Courtney, if I don't. You know, and if you want to shoot me a message and say, hey, I did my Kaplan, that's fine. It depends on you, Natalie. Yes, you can pick any of the Kaplans. Another one of your classmates asked about that, and I said, well, I recommend they're 35 questions generally. I recommend that maybe you do something related to the lecture for the week. So that you can maybe refresh and use your, that might help you. So I thought that would be that's the best answer I have. Um, oh, Courtney, I feel you, honey. You're not the only one trying to organize things. So, but no, I totally get it. No, the fluid and electrolytes, that one is chapter 42. So I would look at something you could do a fundamentals one, or I do score them, Veronica, kind of. So safety would be a good one, Angelica. So anything related to what we've already learned, vital signs, if there's one on vital signs or mobility, look for those kinds of things. So whatever's related to the chapter that you just learned. Monday is chapter 2 in the farm. Sorry, Veronica, back to what you were saying. I score, if you need 63 or better to even look at getting full points. I also will deduct points if you don't remediate. So if you don't if you don't go back and look at the rationale for why, then yeah. So quiz questions are multiple choice for the pharmacology, but the math ones you have to type in your answer. Thank you, Natalie. For fundamentals, it's all multiple choice. Not a problem. Yes, calculators are allowed. So I want you to have, part of being prepared for pharmacology class is to make sure you have a pencil. Pen is okay. Please don't use a Sharpie. I had a student who gave me homework with Sharpie. So pencil, scratch paper, and your calculator. And actually, I expect you to bring your calculator to class all the time anyway. Yes, Mercedes. And chapter, let's see, 5 in the math. And I did look over the math, you guys, and for the most part, everybody did pretty well. There isn't one thing that was really crazy. I would prefer, Courtney, if you show your homework or show your work, especially for at the further in we get, especially because then I can see where you might be going wrong. Oh, you're fine. So that's really important. Further on, guys, I will take points off if you don't show me your work. Well, actually, we'll just start that way. If you don't show me your work, I'm going to take points off because I need to see it. I can't, if you get a wrong answer, it doesn't help me. So I really need to see the math so I can help you correct issues. Yes, thank you, Shelby. I appreciate that. So, FYI, guys, Shelby would be great tutor for pharmacology, and she's really good with the math. Um, and I know she can really, really help you. So please, I appreciate that, Shelby, that you did that. Um, that's awesome. And yeah, so highly recommend if you're struggling, reach out to me, reach out to Shelby. Absolutely, Natalie. For sure. If you can do it and be able to get it to me and show it on paper on the computer, that's fine. Not yes, Tanya. I'm trying to get them up. I Dr. Carp has been is going to be helping with me with that, so I'm going to work on that this afternoon. Shelby, you can just go into Teams and create a team, and you can call it, fundamental study group, 130 study group, and then just add in everybody or send out an invite. You're welcome. I am going to work on that, Courtney. Yes, Nathan, thank you. Make sure you all have webcams or devices with a web camera. Absolutely. I mean that is honestly, Courtney. If nothing else, I want to have it done by end of Friday. Yes, Shelby, absolutely, 100%. Um, and that's where my understanding is with Respondus, and I haven't heard from Dr. Karp, who is going to do a practice quiz with her students. Um, is that there's, but Dean Arias uses Respondus for her master's class that you can put in there. I was looking at my, whatever. So. All right. Anything else, you guys? I'll see you guys Monday too. You're welcome. And I'll post an announcement and let you know as soon as I get the recordings up. You're very welcome. Y'all are going insane. All right. You guys have a great weekend too. If you need anything on over the weekend, don't hesitate to message me though, okay? Thank you, Shelby.